During a client's period of extreme mania and hyperactivity, how should the nursing staff provide for the client's nutritional needs? Options: accept the fact that the client will eat if hungry, follow the client around the dining room with a tray, allow the client to prepare own meals to eat when desired, provide the client with frequent high-calorie feedings that can be handheld. Answer: provide the client with frequent high-calorie feedings that can be handheld. Mania patient hyperactive patients ആണ്. സോ അവർ കൂടുതൽ എനർജീസ് ബേൺ ചെയ്ത ഹൈപ്പർ ആക്ടിവിറ്റി കാരണം കൊണ്ട് കൂടുതൽ എനർജീസ് ലോസ് ആവും. സോ വി ഹാവ് ടു പ്രൊവൈഡ് ഹൈ കലോറി ഫീഡിങ്സ് ഫോർ ദാറ്റ് പേഷ്യൻറ്റ്. So answer is provide the client with frequent high calorie feeding that can be handheld. When approaching a client during a period of great overactivity, it is essential for the nurse to: options: use a firm and warm consistent approach, allow the client to choose the activities in which to participate, anticipate and physically control the client's hyperactivity, let the client know the staff will not tolerate destructive behavior. Answer: use a firm and warm consistent approach. അതായത് നമുക്ക് ഹൈപ്പർ ആക്ടിവിറ്റി ഉള്ളൊരു ക്ലയൻറ്റിൻ്റെ ആങ്സൈറ്റി കുറയ്ക്കാൻ വേണ്ടിയിട്ട് വി ഹാവ് ടു ബി പ്രൊവൈഡ് എ കൺസിസ്റ്റൻറ്റ് വാം അപ്രോച്ച്. സോ ഹിയർ ദ ആൻസർ ഇസ് യൂസ് എ ഫേം ആൻഡ് വാം കൺസിസ്റ്റൻറ്റ് അപ്രോച്ച്. When developing the plan of care for a client in the manic phase of bipolar disorder, the nurse should plan to: focus the client's interest in reality, encourage the client to talk as much as needed, persuade the client to complete any task that has been started, provide constructive channels for redirecting the client's excess energy. Answer: provide constructive channels for redirecting the client's excess energy. So mainly hyperactive clients and bipolar disorder ഉള്ള ക്ലയൻസ് ഹൈപ്പർ ആക്റ്റീവ് ആയിരിക്കുള്ളൂ, മാനിക് പേഷ്യൻസ്. സോ അവരുടെ ആ എക്സസ് എനർജി വേറെ ഏതെങ്കിലും കാര്യങ്ങളിലേക്ക് റീഡയറക്റ്റ് ചെയ്ത് കൊടുക്കുക. ഓക്കെ, അതർവൈസ് ദേ ആർ ഈസിലി mainly they are easily distracted patients. So we have to redirect their energies to some other constructive or useful channels. So here the answer is provide constructive channels for redirecting the client's excess energy. Clients with diagnosis of bipolar disorder manic episode most likely will exhibit signs of passivity, dysphoria, anhedonia, grandiosity. So answer is grandiosity. A client has a diagnosis of primary insomnia. Before assessing this client, the nurse recalls the numerous causes of this disorder. Select all that apply. Options: chronic stress, severe anxiety, generalized pain, excessive caffeine, chronic depression, environmental noise. So here the answer is chronic stress, excessive caffeine, environmental noise. Depressed clients often have the primary characteristics of early morning awakening. Which nursing intervention in the daytime is best for the staff to implement for this client? Options: restrict the client's access to the bedroom, offer the client a series of relaxation tapes, reschedule the client's bedtime to an earlier hour, suggest that the client exercise before going to bed. Answer: restrict the client access to the bedroom. അതായത് നോർമലി ഡിസോർഡർ, അതായത് ഡിപ്രസ്ഡ് ക്ലയൻസിന് ഇൻസോംനിയ അല്ലെങ്കിൽ ഉറക്കക്കുറവ് ഉണ്ടാവാൻ സാധ്യതയുണ്ട്. സോ വി ടു പ്രൊവൈഡ് എ ഗുഡ് സ്ലീപ്പ് അറ്റ് നൈറ്റ്. നമ്മുടെ ഗോൾ എന്ന് പറയുന്നത് 6 to 8 hours റെസ്റ്റ് നൈറ്റിൽ കൊടുക്കുക എന്നുള്ളത്. സോ ഡേ ടൈം സ്ലീപ്പിംഗ് ഷുഡ് ബി അവോയ്ഡഡ്. So അത് കാരണം കൊണ്ട് we have to restrict the client's access to the bedroom, that is mainly in the daytime. Okay, so here the answer is restrict the client's access to the bedroom, that is in order to improve the quality of sleep in the night. The nurse on a psychiatric unit can begin to help an extremely anxious client with a sleep problem who has been assigned to a four-bedroom since admission by saying options: you seem unable to sleep at night. I am going to move you to a private room. Don't worry, you will sleep when you are tired. I will get you the sedative your doctor ordered. So here the answer is I am going to move you to a private room. Okay, so here ഇവിടെ നമ്മൾ പേഷ്യൻറ്റിൻ്റെ കണ്ടീഷൻ ദാറ്റ് ഇസ് എക്സ്ട്രീംലി ആങ്ഷ്യസ് ക്ലയൻ്റ് ആണ്. എക്സ്ട്രീംലി ആങ്ഷ്യസ് ക്ലയൻ്റ് ആയിരിക്കും. സോ അങ്ങനെ എക്സ്ട്രീംലി ആങ്ഷ്യസ് ക്ലയൻ്റ് ആയതുകൊണ്ട് ദേ ആർ മെയിൻലി ടു ആങ്ഷ്യസ് ടു സ്ലീപ്പ് ഇൻ എ ഫോർ ബെഡ്റൂം. സോ നമ്മൾ സിംപ്ലി അതിനൊരു പ്രൈവറ്റ് റൂം ഒരു പ്രൈവസി കൊടുക്കുകയാണെങ്കിൽ maybe their anxiety will get reduced. So here the answer is I am going to move you to a private room. During the intake interview, the client relates experiencing overwhelming, irresistible attacks of sleep. Which sleep disorder does the nurse identify after this interview? Options: insomnia, narcolepsy, sleep apnea, and sleep terror. Answer: narcolepsy. Narcolepsy എന്ന് പറയുന്നത് it's an overwhelming sleepiness that results in irresistible attacks of sleep. And also there will be loss of muscle tone or hallucination or sleep paralysis, maybe at the beginning or end of the sleep. Okay, so answer: a female client verbalizes that she has been having trouble sleeping and feels wide awake as soon as she gets into bed. So the nurse teaches the client about interventions that promote sleep. Check all that apply. Options: eat a heavy snack near bedtime, read in bed before shutting out the light, leave the bedroom if you are unable to sleep, drink a cup of warm tea with milk at bedtime, exercise in the afternoon rather than in the evening, count backward from 100 to 0 when your mind is racing. So here the answer is leave the bedroom if you are unable to sleep, exercise in the afternoon rather than in the evening, count backward from 100 to 0 when your mind is racing. The nurse is assigned to care for a 39-year-old hyperactive manic client who exhibits flight of ideas. The client is not eating. The nurse recognizes this may be because the client options: feel undeserving of the food, is too busy to take the time to eat, wishes to avoid the clients in the dining room, believes that at this time there is no need for food. Answer is too busy to take the time to eat. Manic clients mainly hyperactive ആയിരിക്കുള്ളൂ, so they have no time to take food. So that is the answer is too busy to take the time to